So until people get back on. And so it's good to have everyone here. For those who don't know, my name is Oswaldo Mestri. I am the director of the Division of Citizen Services. And honestly, it is okay. Honestly, yeah, honestly, it is a great opportunity for everyone to be here. It's a great Friday. For those who I heard who are in some parts of Buffalo, they saw a little bit of trinkling of snow, but you know what? The sun is shining today. It's a good day. It's a great Friday. And it's just good to have everyone here. We're joined by block clubs and community-based organizations and coalitions and organizations that have meaningful roles within the community who engage. And so what we tried to do with this forum is to give that forum actionable items to spread to information to individuals and community-based organizations for us to hear from you, but also for you to spread information out. And today is no different. We're joined by a great speaker and an organization that has a lot to offer to you and your communities. And so I'm going to delay too long. This week in government, a lot of things have been going on. I know last week the mayor talked about and released priorities in terms of infrastructure spending, but also priorities in terms of going into communities. Many of you know through the federal government, there are going to be dollars, or there have been dollars allocated and will be allocated to cities pre-pandemic and post-pandemic. But when we talk about the infrastructure of a city and a community is important, and so we've been prioritizing that, looking at 311 calls, looking and talking to council members, but also talking to communities to set that priority. And so when that money does come, we're just gonna go ahead and be able to work in communities that need um, that type of assistance. So I'm excited about that. We're working, I've been asked to work on some other things, other initiatives that deals with safety and crime prevention, and that's going to be very important. There's a Neil Dobbins, um, restorative justice fund that we're going to be offering to organizations as an RFP, which is a request for proposal, meaning that there are organizations that we're going to be looking forward to be putting those requests in to help and assist. And a couple of other different things too. We've teamed up with a couple of foundations to create cleanup crews within the community in that respect too. So excited about the work that we're doing, and you know, I'm looking forward to working with each and every one of you. I'm going to pass it over to my colleague, somebody who works within the Division of Citizen Services. And before I do that, I know she just jumped on, but I have to say something about a friend and a colleague. Our Deputy Mayor for the City of Buffalo, Ellen Grant, is listening in. I'm very appreciative of the work that she does in this space with our seniors, but also within the community. She has a storied background in terms of the work she's been doing regarding social services and mental health. And so it's always just great to have her on board, to lend an ear. I know she has helped me, but she's really has made a big difference within the city of Buffalo. So, Dr. Grant,
Yes.
Deputy Mayor, how are you today?
I am well, thank you. Thank you. Thank you for
Good.
allowing me in.
Well, within her portfolio, which is vast, one of the things within the city of Buffalo, she works very closely with the Department of Community Services, which encompasses our senior services. And we've been doing a lot of different things with them and looking forward to working with our seniors. I feel a little bad, keep on saying seniors, our young folks. I'm just gonna call you our young folks, right? Debbie, don't look at me because you're kind of that young folk area too. Debbie is our president of the Board of Block Clubs, and I think the investments that we make. So let me pass it to one of our younger um, folks who works within the Division of Citizen Services, Nicole Brown. Hey, Nicole.
Hi, welcome to our community engagement block chat, everyone. Sorry if I sound a little bit under the weather. I'm going to quickly go through some announcements so you guys can hear all of the things that our wonderful speaker has to offer. So let me know when you guys can see my screen.
We're good.
Okay, awesome. Okay, so like always, first announcement, super important. If you are unable to pay rent, we have the Emergency Rental Assistance Program. We can help. Visit standupbuffalo.com or call 211 for assistance with your application. There is the Crime Prevention Tree Planting Initiative. So this, if you're interested in planting trees or having one planted in your neighborhood, please reach out to Ron Dixon. His email is listed here, and he is the Special Project Manager for Crime Prevention, and he might talk a little bit more about this as well and let you know how to get in contact with him. There is Bag at Buffalo. So this is important information for curbside pickup for leaf pickups and residential drop-off. There's unacceptable and acceptable material. So this is pretty important. And you can find out more about this on the recycling information, or you can call 851-5014 for more information. And there's also the free shredding event and clothing recycling donation drive this Saturday, 9 a.m. to noon in the Buffalo Public School 54 parking lot. And then, of course, it lists what exactly you can bring to the shredding event. And then if you want more information, you can call 311 or visit buffalorecycles.org. Of course, now that it's starting to get into colder weather and we know it's going to snow soon, it's pretty important to get the PSA alerts. Of course, you can text join Buffalo alert to 30890 for just alerts regarding everything. But if you're just interested in parking updates, you can text join parking updates to 30890. And of course, this will let you know what things are happening in regarding snow maintenance as well. As always, the mayor has a talk of the town every Sunday at 1 p.m. You can find this on his Facebook or on the radio, WUFO or Power 96.5. And again, every Sunday at 1 p.m. And he'll talk about different things going on in the city or important topics that he feels need to be shared with the residents. We in the Division of Citizen Services are still accepting applications for AmeriCorps Vistas. If there's somebody that you want to recommend, or if you yourself are interested, you can fill out an application, or you can get in contact with Director Mestre by simply sending an email or to me at my email as well. If you're looking to start a block club, you can contact the City of Buffalo and Erie County Board of Block Clubs at their email, bobcbuffalo@gmail.com, at their phone number, or on Facebook and Instagram at Board of Block Clubs Buffalo and Erie County. So a few different things going on. On November 13th, from 8 a.m. to 12:30 p.m., Windsong is having the mobile mammography servicing van. So you can scan that to register, or you can make an appointment by calling the number listed there, and I'll put in the chat box. There is the Buffalo Home Visiting Program if you know someone who's pregnant or a new mom. And that one you can also just reach out by calling the number listed there on the flyer, as well as the Buffalo Prenatal and Perinatal Network is hosting a virtual meat raffle this November 16th, and you can follow it live or on Facebook. And you can also go to the link there if you want to participate and get in on the raffle as well. There is a Dewey Park tree planting Saturday, November 13th. The registration for this starts at 9 a.m. You meet at Dewey Park on Kensington, and you can join your friends, family, neighbors as they plant 100 new trees in the Dewey Park in Buffalo's Maston District. And you can RSVP for this by visiting the Tool Library or emailing them for more information, and the event is rain or shine. As well as there's a manufacturing hiring event. If you know anybody who's interested in a career in manufacturing, November 9th, 3 to 5, Northland Workforce Training Center. And you can find out more information at this by calling the number on the screen or contacting Deirdre Pruitt at her email there. There's also mental health and spirituality free community and parent roundtable This is this Saturday, November 6th at 11 to 1. This is an in-person event, so you should RSVP at the email listed on screen. This annual drive-through Thanksgiving food giveaway is going to be held at Prince of Peace Church, 6 to 8 p.m. on November 18th, sponsored by Melina Cares. And there will be warm food, groceries, and turkeys. So please, you can spread the word about this. And then, of course, if there's anybody that has a food business idea or knows anybody that does, they can participate in the Community Table Entrepreneur Program, sponsored by Duville. And then there are different program benefits for applying. And so you can either use the QR code to apply, email Laster at dyc.edu, or call the number on screen. There's also a 21st annual Toys for Joy giveaway. Applications are available at the locations listed on screen. You do have to bring a few items with you in order to apply.
I need to go to work.
You will
Can you
apply.
just put love your block brand?
You can apply with one of the partnership sites or return your application to the same place that you got it. And the deadline to apply for the toy giveaway is December 4th. If you're a parent or caregiver of a young child, there's still a 6-week series happening where you can meet other parents and caregivers and learn new ways to be a positive parent or caregiver. This is sponsored by the Parent Network of Western New York, and that's where you can also find more information. Again, the Northland Workforce Training Center is offering a lot of hands-on training opportunities in different areas, as well as they want to make people aware that they're providing different services in regards to career coaching, financial aid, transportation, childcare, and many more. So you can apply for these at northlandwtc.org or call that number to find out more about what they're offering. As well as there is still a study that the UB School of Nursing is hosting about mindfulness. And this you will be compensated for, so you can participate in this if you are 18 plus, stress, fluent in English, or in one of the following zip codes. And then you can complete the interest form at the QR code or link listed there to find out more, or you can reach out to them at mellowingmind@buffalo.edu. And lastly, as always, COVID is still here. So we do have our COVID-19 website still up for the city of Buffalo. You can find out anything about testing and vaccination information on this website, as well as links to CDC and state and all the different types of guidelines, and as well as business restructuring information and everything like that. So we do encourage everybody to use that if they need it, just to be able to be safe. And so with that, our last slide we're coming up to is if you need emotional support with COVID, we also have the Project Hope at BuffaloUrbanLeague.org emotional support helpline. This is open Monday through Saturday, 8 to 7. As well as you can email them at that email there, and it is free, anonymous, and confidential as well. And lastly, if you do not follow us on social media, please do. At the Division of Division of Citizen Services, at our Facebook page, Buffalo Citizen Services, or our 311 call and response page at Buffalo 311. And then we also have an Instagram, which is Buffalo 311 as well. And if you don't follow the mayor, please follow his page as well as at Mayor Byron Brown. And his Instagram is Mayor Byron Brown 716. And with that, I am going to pass it off to my colleague, Michael Smith. He is the Clean Sweep Coordinator, to say a few words.
Thank you, Nicole. And let me just start by just shouting out Nicole. Every week she holds down this blog chat and these announcements. And for those of you who are public speakers, you know that it's not as easy as she makes it look. So thank you, Nicole, for always being so solid with that. Now, as far as Clean Sweep goes, as you all know, we closed our Clean Sweep season this past week. We totaled it out at 6,559 properties addressed. 4,622 of them were residential. And as the people who are in those on those sweeps know, that's no small number. And we are really proud to have such an amazing team. And again, special shout out to those partners who are actually stopping cars and pedestrians and making sure that they have the information they need Great work, everybody who's been involved there. We were going to have a mini celebration today, but we've actually pushed that on to next week. We're going to be having it at the Rose. I'll make sure to send out another invitation with all of that information. If you can make it, we love to come out, have you guys come out and fellowship with us. And finally, even though the clean sweep season, the 2021 clean sweep season has ended, we are not done with our clean sweeps. So if you have noticed something in the community that you feel needs to be addressed and that our teams can do, please, send it my way, and I'll coordinate with the director and our other departments and see if we can get that addressed. And lastly, just thank you all for being such an amazing team. This has been, my highest capacity job, and it's been an absolute blessing for me to learn from all of you. And with that, I'll pass it to the director.
Thank you, Michael, and thank you, Nicole. In regards to clean sweeps, we will be doing a final report, a little more formal final report. We are, and also a video in terms of culmination of the engagement activities that we've been doing within the community. So look forward to that. We're putting that together. It's important to engage. It's important to talk to people, to highlight those things and make connections. But it's also very important that I believe that we've been doing is to quantify the results. Extremely important to quantify. And so what makes the clean sweeps important is that we have a lot of data that we take in helping pinpoint our most vulnerable, but we also take that data to help us make quick decisions, but also for us to kind of go back and say, what have we done? And then how can we impact and measure that too? I'm happy to say that this program has been highlighted by Harvard University. They've been with us all year. They're evaluating the effectiveness of the program for community well-being and also how we pinpoint crime with these particular clean sweeps. And so look forward to that report. And this again, can't say enough for partners. Bertie tells me that we might have another mini clean sweep coming up. It's all about weather right now. And so stay tuned and we'll let you guys know about what goes on. But these clean sweeps are not aspirational. We use data-driven results to make things happen within the community. So thank you. I do want to add before I bring our guest speaker up, I wanted to give another one of our staff members within Division of Citizen Services an opportunity just to say a few words regarding crime prevention, and more specifically, crime prevention through environmental design and the coursework and the development that we've been doing. We've done 2 cohorts so far. We are planning to do more in the wintertime. We're setting something up real specifically for the residents of BMHA. And so we're working with folks there. But more specifically, tree planting. People say, well, what does that have to do with crime prevention? And when we talk about the built environment, I'm going to let Ron Dixon, who coordinates that program, to speak very briefly about that offering and what we're doing with that. And if you're interested regarding a tree, Ron?
All right. Good morning. Good afternoon, everyone. And so, just as Director Mestres was speaking about the 2 initiatives that I'm really focusing on, the crime prevention is the crime prevention through environmental design, which is CEPTED. It follows really 4 principles of design in community development, which is natural surveillance, territorial reinforcement, access control, and maintenance. And so we try to have community organizations, community businesses, and law enforcement work together to create development that will ultimately lower the crime rate. And so, like Director Mestres was speaking of, we try to use these data-driven results. And so with the tree planting initiative, which is the second piece, we are actually looking to target areas throughout the city of Buffalo that have higher crime rate. And there's data and statistics linked to that show that higher vegetation in those areas will actually lower the crime rate. And so we're going to increase vegetation by planting trees in those respective areas. And if anyone is interested in either one of those, opportunities for crime prevention, please reach out to me. And I know my email was dropped into the chat, but it's rdixon@buffalony.gov. We're looking for volunteers for tree planting, and we're also looking for areas as well throughout the city of Buffalo that has a lack of vegetation there, or have higher crime rates in that area. So we're looking for areas to specifically choose, and we're also looking for volunteers as well. And the same information in order to get in contact for the SEPTED training. Again, we have another class set to go, and that one is going to be for BMHA. And so anyone who is also interested in taking that class, please reach out to me via email as well, who's interested in the class. Thank you. And with that, I'll turn that back over to Director Mestries.
Well, thank you, Ron. It is my opportunity to introduce our speaker. I am going to say that I'm going to have Nicole take over the rest of this to do the Q&A. I am on the road, but our next speaker, who is no stranger to myself, she reminded me how we met, and she's actually no stranger to the Board of Block Clubs, and she is speaking there before the work that the New York State Senior Action Council does in Buffalo, but across the state. New York Statewide Senior Action Council is very important. Many times we talk about our most vulnerable, and we talk about the role in a relationship that we have, not for us to do for them, but what they can also do for the community and how they can help. And so we have to look at this as a two-way relationship, and how that strengthens a city, and how we take care of each other. And so our seniors, in many respects, are most precious commodities. And, in the community that how I grew up, we call them our elders, that we speak of wisdom. And so there's a lot of resources and things that we can learn from them, but it's information that's out there that they can benefit as well. And so I'm excited about hearing what the New York State Senior Action Council does. The director is here with us, Beth Nelson. Beth, the floor is yours. Thank you very much. I'm going to try to jump back on, but if I don't, you are in good hands. And Debbie, you will close us out. Debbie is our president of our Board of Block Clubs, a partner, a friend, and tremendous things that the Board of Block Clubs do within the community. And so, Beth, thank you very much.
Beth, I think you're muted.
I'm on. Thank you. So thank you so much for having me here today. I love talking about statewide, because that's obviously something that I'm very passionate about, the services that we provide to people and what we can help you with. I am the director of what is called the New York State Senior Medicare Patrol. So although I work for statewide, I am also the director of a federal program that goes in the community and talks about Medicare fraud. And one of the reasons that we're here in Buffalo with the Senior Medicare Patrol Program is Erie County has a high rate of Medicare fraud. And we were here to help spread the word so that we can let people know how to protect their identity, how to identify fraud if it happens, and to report it to us so that we can help them fix it. So I give a really quick overview. I'm going to kind of skim through a lot of things, but I want you to let you all know that we are a grassroots advocacy organization led by seniors. Our seniors who become members of statewide are then able to help us work on different things. So for example, public policy, all the bills that go to Albany are reviewed by many of our seniors who are on this committee. They look at the wording. They don't like the wording, or they don't like the bill, or they believe the bill needs to be expanded. So they will bring that to us, and our folks who go to Albany will go and they will advocate. So for example, Epic, right now Epic wants to make the process more complicated on the consumer to have Epic. and to prove that maybe you get a low income subsidy. Where before you just send in the information, Epic would look up your info on Social Security and you would get your low income subsidy and extra help. Now Epic wants you to prove it. They want you to send a letter. They want you to prove that you've been awarded low income so that they can give you this extra discount. We're fighting to have it go back to a very simple application, and one with Epic will find the information, not proving it on the consumer who's applying for Epic. I've worked with seniors for many years. They don't say paperwork. They don't understand this letter. Most people, I didn't even understand it until I read it 500 times. So to ask someone to prove that they're low income and they have that award letter, sometimes it's just not going to happen. We want it to be an easy process for people. So we are advocating for a change for Epic to go back to how they used to do things. That's just one example of something that we're fighting for. And that as a member, they would have a voice to go to our organization and say, no, this is not right. We want to fix this, or we want to change this. We've been providing outreach throughout New York State since 1972. We're going to be 50 years old coming up this year. And I'm hoping we're going to have a big event for that, hoping we can meet in person. So, as I said, we are governed and we're directed by seniors and advocates for seniors on a grassroots level. We have many chapters throughout the state. We are now working on forming a chapter in Long Island, but right here in Buffalo, New York, we have a chapter. They meet monthly. These are all volunteers, but they all hold positions: president, vice president, treasurer, recording secretary, all those things. And I think right now they're meeting on the church on Bailey. It's close to Kensington, I believe. But if you want more information about the chapter, call my 800 number and I will make sure that you get it. Some of you might know Ada Thompson or Helen Sanders. They are involved in the chapter. Helen is currently the president. She'll be, I believe her term is up in December. So where that will all end up in January, I'm not quite sure. And Ada's been around forever. Also, she's a great person and a really great advocate of statewide. So in order to address the growing senior population in New York State, the board of directors voted to institute this policy where we're county by county chapter system. And we've extended our membership in New York residents to include those aged 18 and older. And the reason why we're doing that is that younger people really need to be aware of issues that are affecting seniors and how things are going to look for them in the future. So we want that input and we want them to be involved in our decisions and help give us even their insight, because they're the ones who eventually are going to be receiving Medicare services and other services that affect seniors. And that could be anywhere from your heat to your food stamp to Medicare savings program, what the income limits are going to be and how this will affect you in the future. So we have 3 helplines to assist people. So we have a patient's rights helpline. That helpline will, and it's all the same phone number, so you kind of have to say what you need and one of us will be able to help you. We're all trained, we all know the topics. One of them is patient's rights. We give a lot of information out on what is observation status. So observation status, if you're not aware of this and you're not told, and legally you have to, we make sure that facilities have to notify you in writing that you're in observation status. That could end up costing you a lot of money in the end. And this is where your Medicare comes into play. If you're not in the hospital admitted as a patient for that 3 midnights, your Medicare Part A will not pay for your rehab. That's the money that's going to have to come out of your pocket to cover your stay in rehab. So we want people to know, we want them to know to make sure that they get something in writing. And if they don't, they need to ask, what is their status? So we educate on that. We also educate on other things such as what is a healthcare proxy? What what is the most? Why is it important? Because we want people to know what their rights are and that they should be aware of what is happening to them. Because we know that when you go to the hospital, you don't feel good, right? You just, you don't feel good. And what is your goal? You want to go home. You just, you want to feel better and you want to go home. So they throw all these papers there. You sign here, sign this, do this. But you're not really looking at them and you don't understand. I know last time I was in the hospital, I had more paperwork to fill out than I could even think of. But you need a healthcare proxy. You need a caregiver that can help guide you. So we want to get this information out so that you can share it. And we will come to your group and talk to you about the importance of being ready for a hospital visit or a surgery so that you know what to look for and how to help yourself financially with what might happen to you. We also help people with health insurance and prescription drugs. All of the staff are trained ICAP counselors, just like you would find in Erie County. So we actually do the same training that their counselors do. And we also take the same exam that all of their ICAP. So I don't know if y'all know, like Bill Daniels at Erie County Senior Services. He has his own department. We have the same person. We go to the same classes and we take the same exam. So we are more than willing and able to help you out. We can do plan comparison finders. We can help you find a drug plan that's better for you. Whatever it is that you need, we will look into. We will do our best to help you out. And then, of course, my program, the healthcare fraud program. Healthcare fraud is really big, and there's a lot of scams that go on throughout all the state. I will tell you right now, the two biggest scams that are going on in this area is one is genetic testing. So people are getting phone calls saying that their doctor wants them to have a genetic test to test for cardiovascular disease because they have high blood pressure. This is not a Medicare approved test. Unless your doctor wants to test you, send you for blood work, do everything, but your doctor's not going to give you a cheek swab and say, oh, you have cardiovascular disease and Medicare is going to pay for it. That is not true. It's not approved. That test can cost you $9,000 to $11,000 that you will owe. So my goal is to get the word out to everybody that these phone calls are fake and Medicare is not going to pay for them. And the other biggest one that's going on in this area is also durable medical equipment. So pre-COVID, people were getting phone calls, oh, Medicare, we can get you free back brace, knee brace, ankle, whatever kind of brace, shoulder, and it's free. Well, it was never free. Medicare pays for it. So what they do is they bill Medicare, right? Now, because of COVID, they are actually going a step further and they are contacting your doctor's office and sending them scripts for the durable medical equipment. And they want your doctor to sign up on the script and then they can bill Medicare because your doctor already ordered it, right? So it's a way around what's going on here. And the reality is that in the box of the braces are forms that they want you to sign. So they want you to sign a form that says, I received the braces and I'm financially responsible for them now. So that if Medicare does not cover them, you're going to have to pay. Back braces are $1,500, $2,000, knee braces, about the same. And they don't just send you one. So let's say your right knee is bothering you, they're going to send you one for your left knee too. And they're going to talk to you on the phone. They're going to say, well, how much do you weigh? How tall are you? It's not a proper fitting. We know that people that need back braces, shoulder braces, we all need to be measured because we're all different sizes, height, right? We want one that properly fits you. We want one that you literally went to your doctor to. Your doctor sent you to a DME company and you got one that fit you and that Medicare will pay for. We don't want you ending up owing $2,000, $3,000, $4,000. And the other part of the coin is once your Medicare number is compromised, so is your medical identity. Now, I'm going to tell you a story so I can explain this better. About 14 months ago, I received a lady who lives in Brooklyn. And she said to me, hey, Beth, my name is, I'm 92 years old. And I'm from Brooklyn, and do I sound dead to you? And I was like, no, what's going on? And she said to me that according to her Medicare summary notice, she was dead. She had a doctor's appointment. It was denied because it said date after death of her death. So in my head, I'm like, what's your source of income? Because who gets notified when you pass away? So if you're on Social Security, right, you see that your paycheck every month through Social Security, they are notified and they stop your payment. So we had to call Social Security. We had proof she was alive. 3 phone calls to do that. We had to call Medicare. It's still under investigation. This is 14 months later to clear this lady's medical identity. Now, the ambulance company very gladly gave their money back to Medicare. The hospital is fighting it. But what that does is it also puts her in danger of, if she goes to the emergency room and say she's incoherent, her medical records are now mixed with the medical records of the lady who stole her identity. So if she's incoherent and can't speak for herself, there's a question of how she should be treated medically, because the both medical records are intermixed. And I don't want her to be treated incorrectly. I wanted them to treat her as the now 93-year-old lady who called me in her medical problem, not the person who literally passed away when she was using the medical identity of the person who's alive. So your medical identity is as important as your financial identity. I know that probably doesn't make sense, but but it really does. It's just as important. So when someone steals your Medicare number, or you give it to them over the phone for the braces or the genetic testing kit, that alters your medical identity. So not only will Medicare not pay for these services, but now in your medical records cloud that they have up there somewhere, your information is mixed up. So it's important to call us at our 800 number, because we report the cases, and I'll tell you it at the end. We report the cases to the Inspector General. The Inspector General looks into the broad part of the situation. Our staff look into the other part of the situation. So we want to clear your medical record so that when you do go to the hospital and there's something wrong, or even go to the doctor and the doctor says, well, you're already on pain medication, I can't up it any higher than what it is, and you can only get a 30-day supply. We don't want them denying you something that you need, and we want them to treat you appropriately. So that's about that, folks. I can go on that one for like hours because that's what I do forever. Anyway, we have programs and content that we present to the community. We're located throughout the state. I have staff all the way down to Chautauqua, up to the North Country, which is like St. Lawrence area. I have staff. I have volunteers all the way throughout the state. We have a network of community partners that we work with, that we share a lot of our information. So you can find it, like for example, if you've been on Niagara County Office of Aging, they have our stuff. Erie County, the public library system has a lot of our information. Erie County also posts our information and sends it out. We also, and as I mentioned, we have the 9 chapters, but we do have chapter members who also talk about the different things that are going on statewide. So I did want to bring up something new that we're going to be working on, because I know my time is a little short here. So right now in Central New York, we have a health task force. So this health task force, what they did was help create telehealth sites where people could actually go to a library or go to another secure room situation somewhere for those people who, live in the country, they don't have broadband, they don't have or they can't afford internet because it's really expensive. They could actually go to a site and they're able to have their telehealth visit. And it's a secure room. And these are things that we have worked on setting up for people who just did not have access to be able to, during the pandemic, talk with their doctor by not going into the doctor's visit. So that is actually coming to Western New York starting in February. We will be working on setting up telehealth sites for people who still are not comfortable going to the doctor or just do not have internet and wish to have a telehealth visit. And we will have sites where they will be able to use those. And as I said, it's in the works. I'll know more in February. Right now, I just know that this is something that we are planning on working on in Western New York area, and we'll be here soon, sooner than I'll probably even realize it, because time kind of flies. So we've had many special events throughout the year. I actually present with Gary Brown, who is the statewide elder abuse coordinator, and we do an hour-and-a-half presentation via Zoom. Basically, it talks about the Medicare fraud scams and what's going on. And then Gary brings in the other scams, because right now, Western New York is getting hit big with grandparent scams. It's out there. They have people now coming to the doors to collect money rather than this wire transfer that they were doing. I know on Facebook, Niagara County, it's huge. I've also heard that it's big from talking to the DA's office here, that it's big in Erie County. So we have Gary Brown, who will talk about those things. And then I will talk more about the Medicare fraud situation, especially with telehealth. I don't know if any of you have done a telehealth visit. My doctor's office, I did one. And I know it was my doctor because I called. And this is something that we always tell everyone, call your own doctor. I have staff told me that, well, someone called and just said it was my doctor's office, I would just talk. I'm like, well, how do you know it's your doctor's office? Because really and truly, people don't know. Someone just calls, says, this is your doctor, and then they want all your information. They don't need it. Your doctor's office has it. So I'm always telling people, especially if they have like 10 doctors, you need to call your doctor, schedule your appointment, and just don't talk to anyone on the phone. That way you know who's calling you, what time, what day. We also are very involved with the Assembly Committee on Aging, and we do a lot of Facebook presentations with them to share the word about what they're working on with that committee. We did have one with his name is Assembly Member Kim. It was a really good, it was his new role. So he was talking about what his visions were with this role. And then, of course, I already talked to you about the Senior Medicare Patrol, the Medicare Fraud Program, and just give you some latest stats. So right now, the Senior Medicare Patrol, I have 36 active members that are volunteers throughout the state. I had 57. The pandemic really slowed a lot of people down. I've had some people pass away. I've had some people who are still, depending on what county they live in, pretty much in lockdown. North Country right now, they're in lockdown. They do more community meetings. Erie County is kind of iffy. I know Gloria J. Parks isn't serving lunch anymore. Salvation Army, I talked to Lisa, and she's done a whole new project, but they're not doing lunch anymore. So it all depends on where people are at. But I have 231 partners that I work with throughout the state to disseminate information and to involve them in different projects. And so far, we've served 51 counties throughout New York State. I would like to say that we did all the counties where COVID hit. And so that left my traveling to just the ones that we have via Zoom. The latest scams right now that I have going on, the cardiovascular genetic testing, the durable medical equipment fraud. I don't know if any of you were getting any of the emails regarding the vaccine survey. You can go online, click on a link, and they'll ask you questions. And I actually did it. I did it because I had to know what was on there. It was like, are you going to be vaccinated? Were you vaccinated? By who? And 3, yes, no, or I don't want to talk about it. And based on your answers, then they take you to a page where you can win a prize. Winning a prize, though, you have to pay for shipping and handling, right? So for $14.99, I said I'll get new earbuds, right? But I didn't give them my financial information. I just wanted to see where I was gonna go. But unfortunately, a lady who works right here at the VA went online and she wanted the iPad for $49.99 shipping. Well, the computer kept timing out. And for the 10 minutes it timed out, it created 10 new charges on her charge card. Fortunately, it was a charge card. And we were able to dispute those and she got a new card, a new number. But the reality is they're out there. They just say, oh, and the scam started out very generic. It was just vaccine survey scam. But now it says Pfizer, it says Moderna, so people are like, oh, I took that. I want to take this survey. I want to win a prize. It's not free. It's a scam. They want your financial information. And then, of course, the vaccine card scam. We have many, many issues with people with fake vaccine cards. It's a federal, it's a felony. Because you have the HHS logo on it. You cannot be in possession of a fake card, even though you can buy them on eBay for $9.99. We also have what are called fight fraud toolkits that we are offering to those people who want to give all of the information they can in order to share. So the flyers, it will be articles, it might be an article I wrote. We'll give you all the information that you need. The only thing that we ask for with the toolkits is that we need your number. So if you're going to post it on social media, put it in a newsletter, whatever it might be, I would need your number. So, and there might even be some videos on it. It depends on what we think. So right now we've always had phone insurance, but one of the things that we are doing is called a virtual resident family action council. We all know that during the pandemic, how the situations were in the nursing home. People couldn't go in and they couldn't visit their families, right? They were accepting new patients. They had COVID rooms, which are COVID people in there. So what we did is developed a virtual resident family action council. And these meetings are for people who have a loved one in a nursing home, for them to help us affect change with the future policies of visitation, how to become a caregiver. So they have to admit you to the policy to take care of your loved one. I think that it's really important that people realize that even right now in Western New York, nursing homes are not accepting new patients. It's a law that they can't because they don't have the staff. So they have complete wings shut down because of the low staffing ratio and cannot accept new people. So for those people who have loved ones who may need nursing home care, we know that they're going from the emergency room to back home, once again to the emergency room and back home. So we know that these are issues that need to be addressed so that we can help those people get the correct care that they need. We don't want to see them being bounced back and forth and not being able to get the services that they need. We also know that home care services are low. These are some of the things that we also advocate for. Safe staffing has been big on our agenda, not just for the nurses, but also for the aides. I mean, nurses want 4-to-1 ratio. Well, the aides can't have 50-to-1. You can't have one aide working a whole building. It's just not possible. So we're not only looking at just, the nurses, we're also looking at the aides, and how we can help them. And I just heard Senator May yesterday, and I know that there are some incentives out there that they are trying to pass to help get more healthcare workers. Hopefully that will happen. Right now they're still formatting this plan, but it will be coming to a bill soon. And maybe by next year it'll be passed, and it will help us get more people to work in those facilities. So this is all information you could also find on our website. The website is nysenior.org. and there's a ton of information. And the last thing is, as I said, we had the virtual resident family council. We've got the last thing really and truly is the advocacy. And I already mentioned EPIC. We've been longtime advocates for single payer in New York State. We're advocating for telemedicine, the telemedicine site. One of the things I know that the OIG's office addressed, though, is that if they don't get a handle on telemedicine, we're going to have way more fraud. So they have to put some things in place to help combat the fraud that goes with that. And I'm hoping that that's something that they're working on regularly so that they can start putting some things in place with CMS to avoid the fraud. So other issues have been, we've helped people with broadband. That is something that we are always working on: transportation, nutrition, nursing homes, home care. And I think that's about everything. We do have, and I think I put Nicole, I think you're going to start getting these. They're called our action alerts. So like every Friday, it's called a roundup, and you'll be able to disseminate that information to all of everyone on your email list. Those let you know pretty much what's going on, especially if we have a phone teaching coming up, like with the residents' rights, the virtual family meeting, all of that. It's going to be on the website, and anybody can click on those links, and they'll be able to join. The Bright Fraud Toolkit, as I mentioned, I wanted to send those up, but I also need the numbers for our numbers because we mail them out to so many people, and there's no way that we can every week see if you actually put it in a newsletter, a Facebook page. So we just kind of want something from you saying, well, you know, I have 400 people on my newsletter. So that way we already have that number, and we're not chasing you down because we really can't just chase it down. Lastly, if people want to join statewide, it's $20 for the year. It is worth your $20 because you learn about everything that's going on. There are member meetings, like I said, right here in Western New York. And your becoming a member gives you a voice. So if you have a concern about what's going on with EPIC or the nutrition program where you get your food stamp, your voice counts when we go to Albany. If you're just someone who comes on our calls, then basically, you know, we're going to hear you. We're going to listen to what you're talking about. But when it comes to voting on how we want to change or affect legislation, you need to be a member.
Thank you so much. Oh, I'm sorry. We didn't want to cut you
I know,
off.
I'm done.
Okay. Thank you so much. That was so informative. So that was a lot of information. So I'm sure some people will probably be reaching out, and then I'll have some questions for you. And we actually, not sure if anybody had any questions. I only received one question. It was pretty simple. And they just wanted to know if you were a victim of Medicare fraud, will they still receive service, you know, while there is an ongoing investigation?
All right, so if you are a victim of Medicare fraud, my goal is to clear up the basic part. So I'm going to clear up your medical identity. I'm going to make sure, for example, the back braces get returned. I'm going to walk you through every step, and any of my staff are going to do that too. But everything I need, because we also need information. I need to know who sent it to you. Where are you sending it back to? I'm going to try and help you get a free return label. I'm going to clear up all of that. I'm also going to help you clear up those medical records. The actual investigation for the company that sent it to you could take 10 years. All right. So I'm not a federal agent.
Mhm.
I can't subpoena people. I can't gather all of that kind of, put a case together. That all goes to the Office of the Inspector General and weeds its way down to, like, maybe whatever is happening here is also going on in Tennessee. I don't have a way to link that, but they have a database and a way to do that. So when I look at the takedowns that the OIG and Department of Justice are involved in, They're 4 years, 5 years, 10 years. Just of them gathering the information and being able to present it to court. So my role in the criminal part is very limited.
Okay.
My role in the person part is very involved.
Okay. Thank you. And then Ron put in the chat, is becoming a member the only way to advocate for this program?
Becoming a member gives you a voice to advocate for the program, for whatever we're going to advocate for in Albany, or whatever changes we feel. Like, for example, I gave you the EPIC, where we don't want the consumer to have to dig through paperwork to try and find proof of what's going on. So when we vote on, do we want to fix EPIC or bring it back to what it was, where the oneness does not fall on the consumer but falls on EPIC to do their job, then if you want a voice in that, yes, you need to be a member.
Okay. All right. Thank you so much. So if there's any more questions, Beth, I will probably reach out to you with all those questions via email. And then, of course, if you want to send me the newsletter every Friday, then I can add that to the following email Tuesdays that go out for Black Chat.
Right. And also, if you want the toolkit, the fight fraud that you can send out to people,
Yes.
you know, once again, it is big in Erie County. That is why my position was created in Erie County, was to help combat this. And unfortunately, it was in Buffalo a lot, but then the pandemic hit us all and put a stop on a lot of what I could do. Hoping one day to get back out at different events. But yeah, so, and if you want those, then please let me know and I'll get your numbers from you and we'll get you set up with those too. So,
Okay,
and I
perfect.
reach at Beth at nysenior.org if anybody has any questions. And you can also go on our website, nysenior.org, and find a lot of the information that I talked about today. And
Okay.
more, probably, I'm sure.
Thank you so much. We really appreciate you coming on today.
Thank you for having me. Have a great day.
You too.
Great presentation. Thank you.
Thank you.
Debbie, you are up if you want to make any quick announcements for the Board of Black Clubs.
No, we're good, honey. It's almost 1 o'clock and you know how we are about people's time. So no, we're good. Everything is good. We're taking a break from general meetings for the next couple of months and we'll be back full-fledged in January with some exciting stuff. So you all have a wonderful weekend. Stay safe. I will not see you guys next Friday. I am so sorry, but I have a wedding. So y'all have fun and we'll talk soon. Enjoy, everybody.
Thank you.
All right, yeah, have a great weekend, everybody. And Debbie, don't worry, we're gonna have a separate celebration. Just we'll make it happen. We'll get you there.
No worries. We'll see. Take care.
All right, everyone. Have a great weekend.
Bye.